Transposition of the great arteries. In this presentation, I will address how adults with an arterial switch operation are doing. This is a scene that many clinicians know very well, and sometimes they are fortunate enough to have good news for the patient. After doing a lot of tests, all the results were negative and everything seems to be perfectly alright. However, this does not always coincide with the situation how it is perceived by the patients. Indeed, irrespective negative test results, patient's life can still be affected. The question is, how can we explain this discordance? Well, to a certain extent, it is normal that clinicians initially and predominantly focus on clinical data. Were there complications? What did imaging show? Do the biomarkers indicate a success? And, most importantly, did the patient die? However, there is also another part of the story, and that's the part that rather refers to the perspective of the patients. And in this context, we are talking about the quality of life of the patients. Have the symptoms improved? Did the functional status improve? Did they adhere to the treatment? Do I, as a healthcare provider, meet the goals of the patients? And what were the experiences with care that the patients and families had? When we have a closer look at these factors, the first four can be considered patient-reported outcomes. And instruments, measures that are used to assess these kind of patient-reported outcomes are called patient-reported outcome measures, or abbreviated the PROMs. When we look at these two factors, they rather have to do with the experiences with care that the patients and families have. And therefore the measurements for these factors are called the PREMs. In this presentation, I would like to talk about the PROMs and the PREMs that has been investigated in patients after an arterial switch operation for transposition of the great arteries. And let's focus first on quality of life of the patients. At the same time, I will also include research that looked at the functional status. And the reason is that you will find quite a lot of quality of life studies that in fact have measured quality of life in terms of functional status. If this is appropriate or not, that goes beyond the scope of this presentation, but therefore I bring them together in discussing this aspect. The first study on quality of life in arterial switch operation patients comes from the Netherlands. And in this study, a group of patients was compared with norm data from the general population. And it is important to realize that the general population is not the same as healthy controls. In the general population, you have other patient groups, other chronic conditions that are represented in the general population. And therefore, also a certain proportion of the people in the general population do have one or more chronic conditions. You have to bear in mind this aspect when interpreting the results. Well, in this first study from the Netherlands, quality of life was measured using the TAQUAL. And the TAQUAL is an instrument that covers different domains. When looking at the results, it could be concluded that in terms of gross motor functioning, fine motor functioning, pain, sleeping, cognitive functioning, social functioning, sexual functioning, daily activities and happiness, there was no difference between arterial switch operation patients and the general population. Regarding vitality, depressive moods and aggressiveness, people from the general population were doing better than patients after an arterial switch operation. A second study also came from the Netherlands. In this study, the SF36 was used. And the SF36 is an instrument that comprises 8 health domains. The results show that role physical functioning, bodily pain, social functioning, mental health and general health did not differ between patients and the general norm group. However, in terms of physical functioning, role emotional functioning and vitality, the patients were doing better than the general population. And for some people this indeed may be surprising. A third study comes from France. In this study, these instruments have been used. And these instruments were measuring intelligence, anxiety, depression, physical functioning and mental health. And it was found that anxiety, depression and mental health was the same for the two groups. But in terms of intelligence and physical functioning, the control group, so the norm values, were better than the values of the patients. And a last study in this respect comes from Australia. That's a more recent study, where also the SF36 was used. And regarding the 8 domains of the SF36, no difference was found for physical functioning, role physical functioning, social functioning and general health. Regarding bodily pain, vitality and mental health, once again, patients were doing better than controls. And for role emotional functioning, the results were mixed. When looking at the younger group of patients, no difference was found. When looking at older patients, the patients were doing better than the controls. These were the results for arterial switch operation. Of course, you may wonder to what extent are arterial switch operation patients doing different than people after a mustard or a sending operation. I will not address these aspects in the current presentation. I would like to refer to another presentation specifically focusing on sending and mustard patients, and in that presentation I will address the comparison with arterial switch operation. So these were the findings so far on quality of life and functional status in people after arterial switch operation. What do we know about the other patient-reported outcomes? Well, the evidence, if we summarize it, it looks like this. It is a black hole. Yes, indeed, so far no evidence whatsoever is available on these factors in patients with arterial switch operation. Of course, it does not mean that we don't know anything about these factors. And let's have a look at results from studies in adult congenital heart disease as a bigger group. And this is a study that we conducted a few years ago. We looked at symptom experiences of a big group of people with congenital heart disease. And we found that both in male and female patients, the most frequently occurring symptoms were shortness of breath after strolling 1 to 5 kilometers, excessive perspiration, dizziness, palpitations, getting up often at night to go to the toilet. Regarding the most distressing symptoms, we saw differences between men and women. For men, it was difficulty breathing while lying down, shortness of breath after strolling less than 100 meters, excessive fluid in ankles, legs and abdomen, palpitations and shortness of breath after strolling 1 to 5 kilometers. And for female patients, the most distressing symptoms were fainting, difficulty breathing while lying down, excessive perspiration, severe bleedings due to anticoagulants and palpitations. So first of all, we learned that the most frequently occurring symptoms are not necessarily the most distressing ones. And secondly, regarding symptom distress, being the most distressing symptoms, the profile is different for men than for women. Regarding adherence, there is one study also coming from our research group, one study in which we investigated the adherence to anticoagulation. And we found that about 3/4 of the patients claimed to be 100% adherent to anticoagulation. So this means 1/4 of the patients is not fully adherent. The same, 3/4 of the patients did not forget one dose of medication during the last month. 14% missed one dose during the last month, 7% missed one dose during the last 2 weeks, and 4% missed one dose over the last week. You need to know that this study has been conducted in the pre-NOAC era. So when we are talking about medication adherence, now in the NOAC era, it is even more important than it used to be before. So these are the data that we know from adult congenital heart disease regarding symptoms and adherence. Regarding the PREMS, no studies have been conducted so far, not in arterial switch operation, neither in adult congenital heart disease. If you are interested in measuring PREMS, the Hospital Consumer Assessment of Healthcare Providers and System is a suitable instrument that can be used. However, the focus of this questionnaire is on inpatient care. And since the cornerstone, the emphasis of adult congenital heart disease care is put on outpatient care, we need to look for other instruments. And in this respect, the healthcare climate questionnaire could be a relevant questionnaire. The items in this questionnaire reads like, I feel that my healthcare practitioner has provided me choices and options about my health. I feel my healthcare practitioner understands how I see things with respect to my health, and so on. If we are using instruments like this, we really get an understanding on how patients experience the care that we are providing. So, overall, PROMS and PREMS in arterial switch operation, we have some data, but we also have a lot of blind spots. And therefore, let me come to the conclusions. Patient-reported outcomes and experiences are an indispensable supplement to clinical data to understand how patients are doing. In general, patients after arterial switch operation are doing good. Symptom profile and treatment adherence are, as I said, the blind spot in the PROMS, and the PREMS have not been investigated in adult congenital heart disease today. Thank you very much.